And if you can hear me, just give me your thumbs up in your chat box so that we can properly start our lecture. And first of all, I want to congratulate you to pass your exams. And those of you who got the very good grades like 4 and 3.8, 3.9 GPA, I congratulate them for their hard work and dedication. And those of you who have scored lesser marks, I would say please focus on what you are being told in your classes, what is being um, conveyed to you. Please focus on those things and then you can achieve better. So today's topic, we will start today's topic, which is viral hemorrhagic fevers and dengue fever. As you have noticed in recent years, there was like the number of cases of dengue were increased very much. So to keeping this thing in mind, this topic is being taken up, and there are wide variety of viruses that are involved that cause hemorrhage along with fever, and due to this hemorrhage, which can be very fatal in some of the cases, you have to keep check what are the signs and symptoms of the patient, and then treat them accordingly. So different groups of viruses, and basically the group which we are discussing today, in this the vector is mostly Aedes group of mosquito which transmit this disease. Viral hemorrhagic fevers and dengue. So first of all is the definition. What is viral hemorrhagic fever? And then we will discuss different groups. Viral hemorrhagic fevers are a group of illnesses caused by several distinct families of viruses that affect humans and primates. What happens in this group of diseases, there is severe multisystem, it is a severe multisystem syndrome because it involves many systems at the same time, characterized by diffuse damage to the vascular system. Due to the damage of vascular system, the blood comes into the tissue spaces. There is they use up the platelets and other coagulation factors and cause other problems. Symptoms often accompanied by hemorrhage, wide spectrum of disease, and asymptomatic to fatal, depending upon the type of virus, as Ebola and Lassa fever, dengue fever, especially dengue hemorrhagic fever, they cause severe complications. So one of the major group is Arbo viruses. So what are they? How this name is derived, we will see. Arbo, AR, it is derived from arthropod, and BO is born, arthropod born. Usually these fevers are transmitted by different species of mosquitoes, usually Aedes mosquito, and different ticks are also involved. And the new group of viruses, roboviruses. In this, the rats or rodents are they harbor the disease and then transmit it to the human being. So these are the 4 families, major family, and their type of viruses which cause diseases. One is the toga virus, and they cause Eastern equine and different types of encephalitis. And in this toga virus, this is Chikungunia virus, also it is the example of toga virus. Others are flaviviruses. It includes St. Louis encephalitis virus, yellow fever, dengue, Zika virus, and West Nile viruses. Guinea virus And this causes California encephalitis virus and Rio virus, which causes other diseases. We will focus on this group of viruses, that is the flavivirus, which cause yellow fever and dengue. What happens that this either these diseases, the name of the diseases, they are based on the whatever disease they cause, like yellow fever, because it causes jaundice, and then multi-system involvement of liver and also the blood system. And this dengue and Zika virus, they are transmitted through the different species of Aedes aegypticus. Transmission and life cycle. Viruses multiply in both vertebrate host. When we say vertebrate host, we mean the human being, and then blood-sucking vector, which is mosquito. For effective transmission, virus should be in sufficient quantity to be taken up by the vector. Virus replicate in the arthropod gut and spread to other organs and salivary gland. Only female serves as a vector, as she has to produce its progeny. This thing is similar to malaria virus, like the sexual cycle, as in malarial parasite, the sexual cycle takes place in the mosquito gut, and then through salivary gland, it is transmitted to other non-infected persons, just like that. Some viruses are transmitted vertically from mother tick to the offspring. Humans are often dead-end host. Concentration of virus is too low and too brief. Usually this happens, but in severe cases we see the complications. In yellow virus and dengue, humans have high level of viremia, and they act as a reservoir for the virus. Life cycle. So the life cycle is complex in this type of disease. What happens usually, these monkeys and small bird rodents, they get infected through the bite of mosquito or tick. They are infected, and the infected blood is again sucked by these animals like horse and pigs, and the person who enter into the jungle environment for their occupational reasons or any other reasons, they enter it, or they work there for any reason, so they get infected. And then there is urban cycle, in which this mosquito is mainly the culprit that transmits the disease. About yellow fever, as the name indicates, it's severe, life-threatening disease characterized by jaundice and fever, sudden onset of fever, arthralgia, myalgia, and photophobia. Systemic involvement of liver, heart, and kidney, upper GI bleeding, and hematemesis. Usually they present with hematemesis, and we can diagnose these cases by rising antibody titer. And once the person is infected and gets all right, the immunity is lifelong. Okay, and the vaccine is also available for yellow fever. Prevention is through control of mosquito breeding and propagation of mosquitoes, and then we can achieve this. So in yellow fever, there is fever, chills, headache, severe headache, pain in the different joints are involved, and you can see here, and vomiting. So these are the few of देख सकते हैं आप?
Yes,
If you
madam.
can hear me, just give me
Yes, madam.
thumbs up. Okay, okay. In chikungunya virus, there's high fever, joints. The joint involved are bilaterally symmetrical. What I mean by this statement that both the joints, both the wrists are involved, both the ankles can be involved, and this can remain for a longer, like for a month. It remains. There's weakness and joint pain and swelling. There is maculopapular rash, encephalitis can occur, and the regions that are involved in chikungunya, you have heard of this disease. It happened in Pakistan 2 years back. There was an outbreak, and India and Africa are other countries that can be involved. So all of these viruses, as I was telling you, different groups, they belong to RNA viruses. Different families, but they are RNA viruses. Transmitted through both the species. When I'm saying both the species, that means that is Aedes aegypticus and Albopicus. There are two species that can transmit this disease, chikungunya. Humans are the reservoir for infection. So coming towards dengue fever. Dengue is the most common insect-borne viral disease in the world. 20 million people are infected with dengue virus each year worldwide. These are the figures from like 2 years back. So this figure must have like risen to other level. So dengue fever usually happens in urban areas because whatever man-made things are there, they propagate there, like in the flowering pots, like containers of clean water. These mosquitoes, they propagate or develop or reproduce in those, or in used tires. When water is stagnant there, these mosquitoes, they multiply there. So it is urban mosquito, likes clean water, and epidemic in more than 100 countries. Global prevalence of dengue fever. Whenever it is DF is written, that means dengue fever or classic dengue or dengue fever. And when VHF is written, that is dengue hemorrhagic fever, which is another form we will discuss after that. So why it's happening? Because of the global warming, and people are traveling from one country to another like frequently because of air travel and everything, and then these diseases are being transmitted. Mosquito, once infected, remains infected for life. What it means? It means that mosquito has got a life of 1 month. So once it is infected, till it dies, the infection will be there and it is able to transmit it. Distribution: Indonesia, Australia, Southeast Asia, South and Central America, Sub-Saharan Africa, all over the world nearly. And dengue fever is being more often in the world travelers, people who travel due to business or any other necessities, they can be infected. So these are two species of Aedes mosquitoes that can be responsible for this disease. Aedes aegypticus, you can see it is slightly bigger in size and has got a maroonish red belly. while this albopticus, smaller in size and grayish in color and has got dots. This has also dots, but this is somewhat bigger in size. So this disease is acute, self-limited, febrile illness because it has fever is also there, illness with warning signs, critical disease. While virus is maintained in mosquito and human, occurs in two forms, dengue fever, dengue hemorrhagic fever, or DSS is dengue shock syndrome. This dengue has got 4 serovars, dengue 2, dengue 3, and dengue 4. Antigenically different, distinct dengue viruses. They are 4 different dengue viruses. It is spread by the bite of mosquitoes, Aedes aegypti, found in tropical and subtropical region. How it is transmitted, being bitten by infected mosquito, contact with animals that have been bitten by infected mosquitoes, close contact with infected people or their body fluids. Symptoms, dengue fever begins with sudden high fever, often as high as 104, 105. A flat red rash may appear over most of the body 2 to 5 days after the fever starts. A second rash, which looks like measles, appear later in the disease. Pathogenesis, patient recovers from classic dengue caused by 4 types. Antibodies against that type are produced when patient is infected again with another serotype. Anamnestic response. What do we mean by this? Anamnestic is out of proportion response. There's a lot of formation of antibodies. So what happens here that a person is infected by type 1 or type A of the dengue virus and he becomes all right. And then again he's infected with another type of dengue virus, which is, for suppose we are calling it dengue type 3. Okay. So already antibodies are there in that person because he was or she was infected with type 1. What happens when second type of dengue comes into play? There is formation of a large number of cross-reacting antibodies. They cause the problem. They disturb the vascular hemostasis, and there is blood comes into the tissue spaces, and then there is increased vascular permeability, multiple organ involvement. There's bleeding in the skin or GIT, which causes other problems. So what happens next? There are 2 hypotheses why this happened, how this happens. Hypothesis 1 is that immune complexes composed of virus and antibody activate complement, and because of this activation, there is increased vascular permeability and there is thrombocytopenia, which is very evident in dengue. Hypothesis 2 is that antibody increase the virus entry into the macrophage, secretion of large amount of cytokines, increased vascular permeability, and then there is shock and hemorrhage. So just to simplify it, once the dengue gets entry into the macrophage, they activate T cell and B cell, and there is a formation of antibody. There is antibody complex. These complexes enhance uptake of these complexes into the macrophage again. And if this person is infected with one antibody, one serotype, when he or she is infected with other type, there is excessive number of antibodies cause. So before we move forward, I just want to ask one question. How many serotypes are there for dengue infection? Please answer. I will see your answers. Yes. Just a moment. Okay. Tuba. जी आवाज आ रही है आपको?
यस मैडम, अब आ रही आपकी वॉइस दोबारा?
जी मैं वहीं से शुरू करती हूँ.
ओके मैम.
थोड़ा सा sorry for the disruption in the internet. I'm very sorry for that. So we were discussing about why it is important to understand the pathogenesis of dengue and dengue, that is the dengue classic and dengue hemorrhagic syndrome. Can you answer? Yes, I'm waiting. Muiz Tariq. Why it is important to understand their antibody sensitivities? Muiz Tariq. Okay, because it gets outspread in our city? No. Cross-reacting antibodies, out of proportion response to the second, because we already have got antibodies to one type, they cross-react when we are again infected with another serotype. Okay. So now we will move forward. Do you understand up till this point? Please show your reactions, whether by thumbs up or anything, so that I understand that we are okay up till now, and then we can move forward. Okay. So classic dengue fever, or the simple DF, or you can call it a dandy fever or a breakbone fever, all the names for the single disease, that is classic dengue fever, which is not a very serious disease. People are infected by this, and then they get all right by the end of the week, or 5-6 days they become okay. It is a flu-like or influenza-like syndrome. There is fever, malaise, retroorbital pain, and headache. What is retroorbital? That is the pain behind your eye. There's headache, and then retroorbital is behind your eyes. Severe muscle pain and joint pain, enlarged lymph node, facial flushing, maculopapular rash, leukopenia. The important sign in this, when the person is having fever, chills, vomiting, headache, then you must think about that maybe this person is suffering. So by the different tests, what we do, only CP will show. The number of WBCs will be decreased, and that in our language is known as leukopenia. And then there is thrombocytopenia. That means the level of the platelets will also decrease in this. And it is a rarely fatal disease. Person gets all right by itself. Dengue fever, nausea, loss of appetite, flu-like symptom, headache, fever, severe pain behind the eyes is retroorbital, stomach discomfort, diarrhea, vomiting, muscle joints pain, and overall lethargic. There is feeling of weakness or not being well, and rashes appear 3 to 4 days after the onset of fever. Dengue fever should not be confused with dengue hemorrhagic fever, which is separate disease that is caused by same type of virus but has much more severe symptoms. So what is dengue hemorrhagic fever? You can see there is nasal bleeding, and you can see bleeding in the eyes also. Initial phase is same as classic dengue, which is like flu-like symptoms, fever, feeling of not being well, and headache and chills, vomiting. And then there's development of shock, hemorrhage in the skin, and GIT, common in Southeast Asia. Dengue hemorrhagic fever, severe disease, and it has got a fatality rate. That means it's fatal, cause death of the patient in 10%. If 100 are involved, then 10 out of those 100 are susceptible for this. They can die from this disease. The complications are so severe. Initial picture is same. Shock, hemorrhage, and hemorrhagic shock is due to cross-reacting antibody at the time of second infection. Okay, so in dengue hemorrhagic, what happens? There's dizziness, insomnia, restlessness, bleeding from nose, mouth, and gums, difficulty in breathing, excessive thirst, severe stomach pains, frequent vomiting. Here, pain can be due to bleeding inside the GIT. Rapid weak pulse, pale, cold, and clammy skin. This is the condition in which the patient should be admitted depending upon the severe effects of the disease. And when if the signs of shock appear or there is excessive bleeding, they should be admitted so that their fluid replacement or blood replacement can take place. So I'm further emphasizing on what happens, that here the patient was infected with, there are 4 serovars. I have this picture has labeled those 4 serovars as A, B, C, and D. Patient was infected with type A, and then again it was infected with type D. Because it's a different serovirus, it will initiate or trigger an anamnestic or rapid response, and there will be cross-reacting antibodies which are responsible for massive hemorrhage and complications in this case. So warning signs for dengue. 4 criteria for dengue hemorrhagic fever are fever, hemorrhagic manifestation, excessive capillary permeability, and platelets are less than 100,000. The normal count is from 1.5 to 4.5 thousand, 100,000, like 4.5 per millimeter cube. So initial warning signs will be disappearance of fever, drop in platelet, and increase in hematocrit. Why there is increase in the hematocrit? Why this is happening? Because the blood is going in the tissue spaces. So there is increase in the hematocrit level. So alarm signals are severe abdominal pain, which is due to bleeding in the GIT, prolonged vomiting, abrupt change from fever to hypothermia, change in the level of consciousness. When patient develops dengue shock syndrome 3 to 6 days after the symptoms. So we have to confirm through laboratory test that whether it is dengue or something else. So what we have to do? First of all, first and foremost is that you have to do the CBC or complete blood count or complete blood picture. Sometimes it is called complete blood count or CP or CBC, one and the same thing. And you will find that there will be leukopenia, there will be thrombocytopenia, their hematocrit level will be increased. Okay, so the CBC will show this picture, and when we will do serology of that picture, you will find there is increase in the antibody IgG and IgM. Titer of antibodies is done. The second test will be that, and we can identify the virus through PCR. Okay, so these are different tests that can be done to diagnose the dengue. Or there are rapid test methods are also available, like typhidot or a pregnancy test. What you must have read about them. 1 drop of the blood is put here in this place, and then it can show you whether it is positive or negative. Solid phase immunochromatographic assays are done for rapid testing when there is a epidemic and we don't have time for PCRs or other tests to wait for. We can opt these immunochromatographic assays for rapid detection of IgG and IgM antibodies in dengue virus infection. What is the treatment for the disease? There's no specific treatment, though a vaccine was developed in Mexico for dengue virus, but still it's not licensed in other countries. Fluid replacement is done if the signs of dehydration are there. Aspirin is avoided. Why aspirin is avoided? Anyone? Aspirin? Because there is already bleeding is there, so it will aggravate. Aspirin has a side effect that there are side effect that it causes bleeding. So we are avoiding that. Tylenol in other countries, but Panadol in our country can be used for treatment of fever and headache. Complications: febrile convulsions, severe dehydration, bleeding, low platelet, low blood pressure, bradycardia, and neurological damage, and death can occur. So how can we prevent this disease? How we can prevent this disease? Prevention is always, as they say, prevention is always better than cure. So proper type of clothing is required, that is full sleeve, when you are going to areas where dengue is prevalent. The use of mosquito repellent, the different solutions are available which can be used. Netting can also help from the to avoid the mosquito bites, and minimizing the travel to areas where dengue epidemic is there. Mosquito abatement programs can be done to decrease the mosquito population. So these are different products that can be used, like on the skin, or different mosquito spray, manual, electronic, anything which is in reach can be used. And then there are other things like these are the electric things that can trap mosquitoes. There are plants that the smell of, because of the smell or fragrance of these plants, mosquito don't come around those areas. And then there are netting, different bracelets, anklets are also available. Netting, and then ultrasonic repellents are also there. So a tire filled with stagnant water is a best place for Aedes mosquito, and it can propagate there. So government can also decrease their breeding sites, and in the last, if they breed, you will bleed. So we have to stop their breeding. Then there are solar mosquito repellents are also available that can be used. Okay, and any questions? So this was all about dengue and hemorrhagic fevers. Any questions? Dengue came in due to tires containing contaminant. Yes, yes. Muis Tariq is saying that tires which were used and they were brought in here and that caused the dengue. Yes, it was one of the causes. Yeah, Sidrat is asking why dengue fever is more, dengue hemorrhagic is more fatal. As I described in my lecture, that is because of the cross-reacting antibodies. Dengue has got 4 serovers. Once the person is infected with one type, it develops, he or she develops the antibodies against it, and then when he or she is again infected with another serover, there is out of proportion development of antibodies that cause the complication. So that's why it is more, because of those cross-reacting antibodies cause more severe disease. Yes, one, Muis Tariq is asking why. Madam, can Panadol be given? Yes, you can give Panadol, but not aspirin or Disprin is not given. Distribution, what would be, it is just like a rash. Ma'am, can you explain the 2 hypotheses of pathogenesis? What happens next? Okay, we can go back there and then we can see the slides and explain it again. Yes, can do that. So these are the 2 hypotheses, and this is also explained in your book also. You can refer your book also. Everything is taken from your book. There is nothing outside it. Just the pictures and some graphs are taken so that to make you understand in a better way, we have done that. And every other thing is from your book. So the hypothesis 1 is immune complexes, that is antigen and antibody composed of virus and antibody activate complement. And this increases the vascular permeability and there is thrombocytopenia in hypothesis 1. In hypothesis 2, antibodies, they enter into the macrophage, increase the virus entry, then there is secretion of large amount of cytokines. There is increased vascular permeability and fluid in the tissues, and then there is shock and hemorrhage. So these were 2 hypotheses. You can see dengue fever, direct entry, and what happens that part of it are like presented to T lymphocyte. They stimulate the B lymphocyte. There is a production of antibodies, and along with it, there is release of cytokines. Okay. Once these antigen and antibodies are formed, they increase the entry of the virus into the this macrophage, and then you know the other complication will take place. Okay. I hope I'm clear. Do you understand? Do you follow now? Please write in your chat box. Madam, thank you. Okay, thank you. I will try to. They are assigned to me. Okay. Papaya leaves juice helps in increasing the platelet. One Rida Khalid is asking. Papaya leaves juice helps in increasing the platelet. Beta, I do not know. I do not have the facts. Please share with me if you have got some research paper that papaya leaves increase the platelet count. I do not know. People do all sort of things when they are sick. Some they take padhe hue chane, papaya juice, anything which helps. I think there is no harm in it, but I do not have the scientific facts. Okay. What is yellow fever? Okay. Who's asking? Saida Simra. Okay. I'm telling you. Yellow fever. We are calling it, first of all, we are calling it yellow fever because along with fever, there is jaundice. Because it is transmitted through mosquito, which is carrying the disease. That's why it is grouped under this group of disease. It's a severe life-threatening disease characterized by jaundice and fever. There is sudden onset of fever. Here also you can see the bone and joint involvement is there, just like dengue fever. Arthralgia. Arthralgia is pain in joints. There is myalgia, pain in muscles, and there is photophobia. What is photophobia? It is sensitivity to light. The patient cannot bear the light. They are sensitive to light. They like to remain in dark. They are comfortable in dark. There is systemic involvement of liver, heart, and kidney, upper GI bleeding, and hematemesis. Hematemesis is blood in vomiting. And we diagnose it through rising antibody titer. Here, what happens once the patient is infected with yellow fever and recovers from that disease, then there is lifelong immunity. Okay? And the vaccine is also available for yellow fever, but it is not so with the dengue fever. I can say that because in Mexico they synthesize the vaccine, but it is not licensed yet. Okay. So Sidra, it was Sidra or some who asked this question for yellow fever. Okay. So do we have still time, Sharik? हमारे पास और टाइम है? हम और क्वेश्चन ले सकते हैं या अब इधर बंद करना है?
मुझे मैडम
ठीक है, उन्होंने कह दिया। अच्छा, मुझे शारिक ये कहना था कि कल भी मेरी क्लास है, प्लीज मेरे वो भी सेंड कर दीजिएगा और जो मॉडरेटर है उनके नाम भी सेंड कर दीजिएगा।
ओके मैडम, ये मैं आगे आपका मैसेज आगे फॉरवर्ड कर दूंगा।
मुझे मैं जरा थोड़ा सा अनम्यूट कीजिएगा मुझे, ताकि मैं वो फाइनल उनको बोल दूं, और अगर कोई और क्वेश्चन है दे कैन ईमेल मी, मैं बात कर सकती हूँ। शारिक, हेलो जी, प्लीज any other questions that are left, please? I'm sorry because we started late, but again there is another lecture which is lined up, so you can ask questions through email. My email is pushpa.vali@duhs.edu.tk. Please send me your question, and I will try to answer all your queries and questions which were not taken up in the lecture. Thank you. Thank you. Yes, only female mosquito bites. She has to take the blood meal for their progeny. Okay. Thank you so much. Please, any other question, you can email me at pushpa.vali. Thank you.
Okay, ma'am. Allah Hafiz.
Okay. Allah Hafiz. See you tomorrow.